this information was not solicited. Instead, the report provides an in-depth reviews of both the COVID response by the department, as well as the department's behavioral health transformational efforts. Dr. Chow, I want to thank you for your comments on the draft, and I'll be making the requested changes. So the report will open with a welcome and a message from our Director of Health, Dr. Grant Colfax. The message is under development and will be included in the final report, but the message will focus on the impacts of COVID-19 and the department's response to the pandemic. The director's message is followed by a message from Commission President Bernal. His message discusses how the fiscal year started with the Epic Go Live and Health Commission changes and ended with the onset of COVID-19. The message also highlights how the health inequities associated with COVID-19, along with the protests that arose at the end of the fiscal year in response to police brutality. Both messages provide our leadership's introduction to the department's activities discussed throughout the report. The next set of sections provide an overview of the functions and services across the department. The sections start by introducing the department's two main divisions and their roles in protecting and promoting the health of San Franciscans. The next section reviews DPH's True North and its 6 true pillars, which is followed by the most recent organizational chart, or actually the organizational chart as of June 30th, 2020. The last introductory section focuses on the Health Commission. The section provides an overview of the structure and function of the commission, along with the individual bios for each commissioner. As part of the Racial Equity Action Plan, this year's report presents demographic information on the commissioners, and this data will be continue to be collected and presented in future annual reports. So the largest section of the report represents the three feature stories that showcase some of the highest profile efforts by the department in the fiscal year. As I mentioned at the start of this presentation, given the scale of these efforts, these articles are longer than those in previous reports. The first feature provides an extended overview of the continued transformation of the behavioral health system. The article discusses the goals of the transformation, the work that's currently underway, including efforts to make it easier to access care and providing more locations for treatment and respite. The feature also touches on future projects that are being implemented in the following fiscal year. The second feature discusses the establishment of the Office of Health Equity in the department. And the last feature provides an in-depth review of the department's response to the COVID-19 public health emergency. The feature highlights activities ranging from testing and case investigation, contact tracing, to alternative housing efforts, and providing information and guidance. The section also provides key indicators on the impacts of COVID-19 throughout the fiscal year, along with data points that capture the scope of the department's response. So the next major section of the report focuses on data, starting with the department's budget. The budget data provides information on expenditures, revenues, and major investments. So for example, $28 million was invested to add and extend funding for approximately 200 behavioral health treatment and recovery beds. The next data section highlights San Francisco Health Network's data on visits, patient demographics, and payer type across the major systems of care. And lastly, each of the 10 Health Commission resolutions adopted last year are included in the report. So the report ends with an overview of the department's service sites and contractors. The maps of the primary care and behavioral health service sites have been updated to reflect any location changes, and a list of our community contractors is also provided in the report. Lastly, the report includes additional DPH resources, such as where more information can be found on the Health Commission, where individuals can get health coverage, varying foundations and community organizations, and lastly, of course, San Francisco, where information can be found on San Francisco's COVID-19 response. So this concludes my presentation. Any additional feedback will be incorporated into the final report and presentation to the full Health Commission. For next year's report, we're planning to provide a much fuller review of the department's COVID-19 response, and we plan to have the report ready by this fall. And at this time, I'm happy to take any questions or comments. Thank you for your time.
Commissioner Chow, may I check the comment line to see if anyone has comment?
Yes, please.
Sure. Folks on the comment line, please press *3 if you'd like to make comment on item 7, which is the draft DPH annual report. Again, *3. No comments, Commissioner.
Thank you. And thank you for your very succinct presentation, and we'll discuss a little about the annual report. But first, your last comment said that you were going to be preparing a COVID-19. Is that a separate report, or in terms of further information on our COVID response as a department? Or is that what you're talking about for a future annual report?
Yes, thank you for the question. And to clarify, it would be for a future annual report that specifically focuses on the department's COVID-19 response efforts over the 2020-2021 fiscal year.
Right, because of course this one ends almost a year ago.
Yeah.
We're constantly behind, but it can't be helped. So again, we did get some comment from Commissioner Guillermo, who thought that this was a very fine report, and I want to echo that on my part. I think that this is a very comprehensive report of the activities of this year, minus, of course, the work that was somewhat truncated. So that just kind of brings to my mind right now, as we're looking at how we might get this area that you said other departments could not actually be highlighted, because a lot of the work, of course, had to be truncated or reduced during this period of time. So do you think we should put something like that in here in terms of also we have the COVID response, which is really an excellent summary up to the end of June. Very well presented, very nicely done, and very easy to read, really, as a very complicated topic. But I'm wondering if there should be a page discussing how the department itself continued its work even as it pivoted to do it. I think a lot of people do not understand, and now I'm even talking about myself, what the disaster worker really was in terms of how that comes into operation during, and this, of course, has been probably the most major disruption we've had, where DSW was actually assigned to reassign everybody throughout the city to key jobs, right? So, I mean, it's even bigger than the 89 earthquake, I think, in terms of response, because it, was citywide versus being limited to neighborhoods, even though, it was a different kind of disaster. But I think that the fact that the city has this emergency preparation is really important, whether it goes here or maybe in your next report, in terms of understanding how well the department really pivoted and was able to do all these things that you really write into our report on the COVID response. And at the same time, it might be very good to try to also note that many of the key functions and the basic functions of our department continued in spite of this. And that was a real challenge when people were short of staff. And, in spite of that, our hospitals continue to function and operate and be of excellent quality. Our primary care departments outreach to the members who are enrollees. You do mention that, but somehow it'd be nice to have a summary of the fact that this department pivoted and so many people stepped up to do their job.
Yeah.
What do you think? And I don't want to toss a whole bunch of extra work onto you, but I think that would really be rounding out what is a a very nice summary of how COVID response happened, but also on the back end, we kept we kept the fires burning, and the people who needed it continued to get their care.
Yeah, yeah. I think that's something that we can definitely explore in this cycle, and at a bare minimum, if we could incorporate that summary in the COVID section about how the basic continuity functions continued in the department. And it's something that we can also look at how we would kind of summarize and explain in a more COVID centric or focused report next year as well. So I'm not sure if that would be amendable. But
Oh, yes, and I think probably in next year's the explanation of our, the city's whole COVID coordinating center and so forth.
Mhm.
Because as we ramped up all our testing and did so well, and then when the vaccines, although of course there are always early missteps, I mean it's clear that there was a great effort made, and in that area, uh, much of the national advice to try to get into neighborhoods and communities, um, our department had already had the foresight to do, along with the mass screening. So
Mhm.
I think it was really wonderful to see that. And then Nick's report can show, or does show, and will, I hope, continue to show the very fine public health response that we've had, although at a great loss, for our economy. But
Mhm.
I mean, we should at least highlight where, we really save lives and all in
Mhm.
your report. I think that would be really wonderful. But on this one, I think it'd be really nice if we could to also show how we were able to continue, to keep the fires burning and the people taken care of safely.
Mhm.
We had to remove a lot of elective work.
If I may jump in, I'm sorry to do so, Commissioner. Max, do you know if Dr. Colfax's letter is going to address that? Because that also could be another way and another place that could be done.
The letter's still under development, but we can still kind of explore how that could be added to the letter. I think there's flexibility to talk about how these continuity services continued despite all the deployment.
Great. Because Dr. Chow, I think your message is loud and clear that this should, that the message of the continuity of services and like the courage and the dedication of staff in that regard has been heard. And so I think Max can take that forward, whether it's in Dr. Colfax's letter or if it's actually embedded in that report, and then certainly this year and then possibly next year, or vice versa. Next year for sure and possibly this year. Is that okay with you, Dr. Chow?
Um, I leave it to Max as to how to bring that topic and how best to explore that. Absolutely. Uh, you know, I did want to at least talk about page 23 because perhaps it wasn't as clear. But I think we had the same issue at the beginning of last year's report, where we have a whole series of big items, but it isn't clear why these were particularly highlighted. So, did you understand that in terms of what I was looking for? Some sort of introductory topic or heading or something as to what these meant, like the 28 million, the 600,000. Why are those important?
Yeah, that's something that we can talk with the budget office about how that could kind of best highlight and introduce those specific investments.
Okay, no, and I think we, like I say, I kind of recall last time the first drafts also, highlighted a whole bunch, and I forget how we actually then
Mhm.
finally at the end made sense out of how I'm listing what the best investments are for this year or something like that.
Mhm, mhm, mhm. Yeah, I
Uh,
think we had a brief message regarding that. Thanks for the feedback.
Otherwise, I think one of the things that actually came out as a benefit, I think, is to understand uh, some of the major achievements and topics rather than just simply the department. So I would think in the coming year we're going to combine both.
Mhm,
If you can, the highlights of the different departments that don't often get highlighted
mhm,
and what their year was about, and then At the same time, I think this idea of having a more expanded discussion of some of the major initiatives really makes some sense and adds to the depth of the report.
Mhm,
So
mhm.
I want to, commend you for having really done a very nice job in those, like behavioral health and so forth. And that's going to be another big topic next year, right? The,
Yeah.
mental health and
Mhm,
how our department is helping to achieve. And I think as big a story, hopefully, as
mhm,
COVID as, and hopefully as successful.
mhm. Wonderful.
I I don't myself have any more, comments. Uh, I know Mark has also watched these reports over the past 10 years. And I think from his perspective, are there other thoughts also that you might have?
Oh no, number one, I wanted to say that Commissioner Guillermo just texted and said that she has no other comment. She feels like the report's excellent. And I feel like it's a very well organized report, especially for this kind of crazy year when leading up to COVID, when we don't have a lot of bandwidth. I think it covers what the DPH has done in a wonderful way and gives the public and everyone who's going to read it the sense of the scope of work. So, Dr. Shaw, I think with your comments you've made, and if they're able to incorporate those nuances, then the report will be fantastic. And then the full commission still has a chance to review it. And although it'll be final by the time it gets to them, there's still the opportunity for them to make the little icing on the cake nuance comments.
Yeah,
So,
and lastly, I just I think we are expanding and really doing a good job in adding the additional resources. Uh,
Mhm.
remember a number of years ago that was just kind of very skinny and missing, and yet now, especially with so much information online, it is terrific to really have an appendix that allows you to allows any reader to want to look more in depth at any of our areas of operation. So, want to thank you for even expanding that further.
Great. Thank you, Dr. Chow.
Thank you. Uh, and let's say we already took the public comment, for which there
right.
was none. So, which item shall we move on to, and how is Commissioner Guillermo doing, and her ability to uh, uh, give her input on the items?
She said that she should be available any moment. So to go ahead and not with the minutes, but to move forward with the contracts report. And by the time the vote comes, she should be able to weigh in.
Okay, good. Let's do that.
Great. Ms. Ruggles.
Hello. Okay. All right. So today we have a short contracts report, the monthly contracts report. We have Catholic Charities. This is a very straightforward contract in that we went out to bid and they were reselected. So this is a continuation of an existing service. So today what we're asking for is approval of a new agreement to continue existing services. This is the HIV Assisted Housing Subsidies Program. And the amount is over the term, which is from July 1st, 2021 through June 30th, 2026, is a total amount of $6,109,208. You have a copy of their last year's monitoring report of their prior contract, or 1920 actually is what's available, and they met 100% of their performance objectives. The one area that they are working on is to develop, to plan for and conduct a client satisfaction survey. And so I believe that process is being done this year, and I don't have an update on that, but that was the one piece that they were working on. But otherwise, very good. They meet all the standards. And I believe we have staff on the line if you have any programmatic questions that you have.
I just had first a question. Now that I realize that I actually saw it, that it was a rebid and a renewal in essence of the same contractor. What what did we spend the prior year for this contract?
I believe it was the same amount. I know we usually stick that on there. It wasn't on there, but I don't think there's a change. Is Joseph on here?
He's give me 1 second. Joseph, is this you,
Yes.
Joseph? I've unmuted you. Okay, great.
Hello?
Yes.
Yes, it is exactly the same amount. You're correct.
Very good. Okay.
Commissioner Chow, Commissioner Guillermo has also joined us, just as a FYI.
Oh, good. Okay, let's see if Commissioner Guillermo has any questions on the Catholic Charities contract.
We're on item 3, Commissioner, the contracts report, the Catholic Charities.
Thank you. I don't have any questions on this contract, especially given the information that this is a renewal and it was for the same amount as last year. So I'm assuming all is well with this particular contract.
Okay, so let's see. We have very short contracts this time. That's very good since I had to chair this meeting. And so let's say we haven't done the minutes yet, but shall we go ahead and recommend have a motion to recommend this to the commission, and then we'll go back to the minutes.
Yes, sir.
So
Commissioner Guillermo.
if we could have a motion for recommending to the commission the contracts report.
Yes, I move that we recommend to the full commission.
Okay, and I'll second that.
Thank you. And we can go back to item 2. And thanks everyone for your patience that we're kind of dotting around the agenda. Item 2 is the minutes of the May 4, 2021 meeting. And Commissioner Childs noted, and I apologize for my error, at the bottom of the first page, I transposed 2 letters. So the last line, the first line of the last paragraph should say regarding the UCSF Child and Adolescent Services contract. Otherwise, I haven't gotten comments from other people.
Okay, and we all do that. So thank you. A motion for acceptance is in order.
So I will move that the minutes of the May 4th Finance and Planning Committee be approved.
And I will second that. Are there any public comments?
Folks on the line, if you'd like to make comment on this item, please press *3. No comments, commissioners.
Okay, so then we'll go on to our next agenda items, which are the new contracts, I think, right?
Sure, yes, sir. Item 4 is a request for approval of a new contract with ANA Health Services, LLC.
Okay, I'll just go ahead and introduce this contract. And I know we have Luis Calderon, who is here, as well as a representative from the agency. But just to introduce it, ANA Health Services, LLC would be a new contract for the Department of Public Health. And the authority for this contract is as a pilot project. So it would be up to 2-year pilot to test this model, which is, I'll let the experts talk about the model. But in any case, it's a 2-year contract. It's new. The total amount, including contingency, it would be $3,270,400, and the annual contract amount is $1,460,000. So I think I'll turn it right over to Luis to explain the model and why we're doing it, and any other of your questions.
Great, thank you, Michelle. Good afternoon, Commissioners. This is Luis Calderon. I'm the Acting Deputy Director for Transitions. In our work through Mental Health SF, we have been exploring, and especially in the new beds and facilities group, we have been exploring to find new beds to be able to place behavioral health clients. In one of our gaps of services, we have identified that many of our clients that are adults and older adults with mental health and substance abuse use are not able to go to certain programs because of lack of accessibility or lack of ability to get personal care assistance or medical assistance. So if someone is not only dual diagnosed, but maybe triple diagnosed with mobility impairment or some other medical condition, they're not able to obtain many of their or go to rehab programs that we have in our system of care. We have found that ANA as a new partner, and we're looking to them to be able to provide in an RCF model, so rehab in a residential care facility license model to provide support for these adults and older adults with dual and triple diagnosis, and be able to provide the rehabilitative resources so they can rejoin our communities and be able to step to lower levels of care. They are a very interesting model because they not only they provide ongoing treatment in a residential care facility program, but they're able to step people into independent living programs, and they have been able to do that by incorporating independent living units within their program where they provide services. In one of their current facilities, well, actually in both of those now in their facilities, they have set aside a portion of their units to provide independent living housing. So not only these clients go into a residential care facility, they get the care that they need, and they get the residential treatment component. And then when they graduate from this program, they're able to go into the independent living model and continue to get some support from the building that they just graduated, from the services from they just graduated. It is our hope that we will be able to refer some of our clients that are using our system of care, residential treatment programs for housing purposes, or they're not able to get to those residential treatment programs because of lack of accessibility or the need for personal care. Commissioners, if you have questions, I'll be glad to entertain questions.
I have I don't know if Commissioner Chow is on mute.
Oh, I was just going to ask for public comment first, and then we'll get to your comments.
Sure. Person on the public comment line, if you'd like to make comment on item 4, the contract with ANA Health Services, please press star 3. Star 3. No hand, commissioners.
Thank you, Commissioner Guillermo.
Thank you. You know, as a new member of this committee, I'm not as familiar with how particularly new contracts are processed or sourced. So I had a couple of questions. One about the program itself. It doesn't indicate here where the site is for the boarding care facility, or maybe I'm missing that. So that was one question. And then the other was, how do contracts like this, how are they sourced, particularly if it's a for-profit facility that we have not had partnered with or had a contract with or previously? And then a third question had to do with the cultural competency requirements. What that sentence, the contractor will participate in applicable culturally competency requirements. What does that mean? So those are the 3 questions I have.
Okay, Commissioner. So let me answer first. Location. The facility that we plan to place these clients is located in San Pablo. However, the 20 beds that we're contracting in there, we plan to move them to a facility that ANA has purchased here in the city on Shotwell Avenue and Chartwood, Street, sorry. And they are in the process of rehabbing the facility. It used to be a former board and care that closed several years ago that we used to contract, and the family went on out of business, or retire, I should say, and they closed the facility, and ANA purchased the building and in the process of rehabbing. So that's the facility in San Pablo, the 20 beds that we're purchasing there. The second question was about sourcing. This is a pilot program currently. Usually these contracts are two ways. Larger contracts like this ones are put for requests for proposals. And so we put it out for bidding, and we request for bidders to submit proposals. This is a different model. Again, we're testing how residential care facility, usually where we place clients, usually for their life, both adults and older adults. We don't tend to expect many clients to step down or return to independent living. This was a very interesting model for us, and we look forward to trying to test how we can work with them and refer these clients to help them step after they graduate from the program into independent living housing, and no longer needing the wraparound services and the cost to be for the lifelong of the client in that we pay a patch for residential care facility programs. And the last one, cultures of competency. That, I believe, that's part of the contract program or requirements. And to tell the truth, I'm not 100% sure how to answer that question. I believe that's going to be part of the RFP or the contracts, the requirements. I would just say that ANA on every provider, nonprofit or not or for profit, have to register with the city and be vendorized and agreed, and they have to be met. They have to meet certain criteria and able to provide benefits and able to provide certain cultural competency there. So they have already submitted all the paperwork, and now they are ready to do business with the city for us.
So as a follow-up then, will, and in terms of evaluating this pilot program, one would the evaluation components or the measurements, are those going to be, just in terms of outcomes as the residents step up? Are those in place already, or will those be developed as part of the pilot? And then again, from the cultural competency requirements, maybe not just for this contract, but given that we're talking about this contract, the evaluation measures as well for documenting the achievement of the culturally competent requirements. Where is that presented, or how is that recorded?
Do you want me to, Luis? I could step in for a sec.
Sure.
That's right. Hi, Commissioner. This is Michelle Ruggles. I want to even step back one step further. In order to contract out, we have to have approved authority, which comes from a solicitation or in this case, actually, we had to apply through the city's Office of Contract Administration for approval under the category of a pilot project. So it's a pretty formal process that they had to agree to. Now, in terms of annual monitoring, this is a generic answer. We have an annual contract monitoring that's done by the Business Office of Contract Compliance. And so the contract objectives are developed, and then they're posted on a website, and then they're measured at the end of the following year. I think in this case, these objectives, because it's new, right, and a pilot, will be probably individualized and maybe a combination of individualized and more generic for the modality, but they'll be added into the contract and reviewed at the end of the year. And in terms of the cultural competency, your timing is perfect, except I don't have a great their full answer, but I just received something from Dr. Bennett in our office, who's working on racial equity and wanted to incorporate their new tool for cultural competency and racial equity into next month's contracts presentation. But in the past, and so that's been what's going through a review. That is what they're working on, and it sounds like they've come up with a new tool for that. There was an annual cultural competency report, and there were certain aspects that were reported on, and contractors were responsible to respond and provide information. And so that hasn't happened as formally. It hasn't happened actually as part of the contract. And so that language actually needs to be updated, and will be, because as of next month, we'll have a tool to present. So I don't have a great answer today, but there's something coming in July.
Thank you. And I think we're aware of that from the commission standpoint.
Okay.
Because of what we have been following in terms of development of the tools. And so that was one of the reasons I was asking is, how is that going to be incorporated into the business, I guess, part of the contracts process and I guess the monitoring of the outcomes and its success, or the success of contracts. And then in
Right.
particular this one, since it's a pilot, probably one of the first pilot programs under Mental Health SF that's going to be executed. And I think we have a responsibility to make sure that we're scrutinizing these initial contracts in a way that is going to be as beneficial to the department's goals, the city's goals, and certainly for the clients.
Commissioner Guillermo, may I jump in? Is it possible that I can do some more checking and we will try to do better with follow-up at the next Finance and Planning Committee meeting, as well as possibly other communications? Because I think, as Ms. Ruggles said, there's lots of going on, and because it isn't codified yet, I'm hearing you and you're understanding that, but I want to make sure we're meeting in the middle so that you all are getting as much information as we have.
Yeah, it's not my intent to hold anything up. It's just, again, questions that I have as being a new member of this committee and then trying to connect the dots.
Right, and so I wanted to welcome Commissioner Guillermo. We'd have normally done at the beginning of the meeting, but recognize the challenges, and thank you for working so hard to get on to the video for the meeting. First of all, thank you for becoming a member of the committee. I think you've hit on a very perfect question, and Ms. Ruggles' comments also parallel what I was thinking of. The history of the cultural competency requirement actually grew out of a need to assure that, and in this case, I should say in the early case, that people who were caring for HIV patients, that is the contracts, were managed by people who actually understood the population that they were caring for. And this expanded to be that it was important to be sure that it's very much as what we're now doing as a whole city in terms of racial equity, except it wasn't just based on racial, but in this case, it began with sexual orientation. It also the commission started looking at the board of directors, and that's why the board of directors is actually listed on here, in order to see if the board of directors, if there's any question within the board of directors, that has remained as one of the elements within the contract to review who the boards of directors are. Commissioner Sanchez, for example, often was quite concerned that certain boards of directors from the East Coast, for example, were not as attuned to the needs of San Francisco. And so often we would be discussing board members. And of course, it was always interesting to know who was on what boards. We found some very prominent political people who then had moved on to boards of profits and nonprofit organizations. But I was going to, and I think, reinforce what you have asked for and what Mark actually picked up. And we need to understand how cultural competency is now measured. At one time, it was a totally separate measure, and we all wanted it melded into the contracts process. I mean, there were two tracks. People were submitting reports separately from the contract itself. And I think the two have to be merged together still. And this might be the opportunity with Dr. Bennett to really work on a process that would then work for both the contractors and ourselves and create what we've all looked for and what has become now, in a way, a different focus, but still the same question. How are we assuring that there is cultural competency in the vendors who are going to be caring for our patients? So that's I'm glad you picked up on that, and I think that allows us to move into that question and bring back a report to this committee as to how we're intending to do that, especially in the light of the racial equity lens. So, Mark, is that okay?
I heard a lot from both of you. Thank you both, commissioners. And I'll do my best to communicate with you. And I know Ms. Ruggles is on it, so we'll figure out how to communicate by the next meeting, at least where we're at. And hopefully, that Commissioner Chow's comments give context, and that you're hearing that we're going to try to do our best to answer your questions.
Absolutely. Very, very helpful. Thank you.
And so we need a motion to recommend this pilot contract to the commission.
So I move recommendation.
And I would second that.
Thank you
And
both.
so we will move that forward to the commission, and we'll
Yeah.
go on to the next contract, please.
Sure. Item 5 is a request for approval to enter into a retroactive contract between the San Francisco Community Health Authority and the DPH.
Right, and just to finish that paragraph, it's for the implementation of the San Francisco Medical Reimbursement Account Cash Grant Program, which was authorized by the mayor actually as part of her 17th supplement for the mayoral local emergency declaration. And I think we're up into the 30s now. So the total amount would be $14,903,500 for a term of 18 months, so July 1, 2020 through December 31st, 2021. I'm going to turn this over actually to Alice Cruniati, who can explain more about how the program is going to work and also answer the question that I think it came from Commissioner Chow posed about what is the administrative percentage retained by the San Francisco Health Plan, and what has been the performance evaluation on previous contracts?
Hi, good afternoon, Commissioners. This is Alice Cruniati with the Office of Managed Care. So this program was created by the Mayor's 17th supplement, and it allowed for SF City Option employees who met certain criteria to receive a one-time cash grant of $500 for expenditures that were not covered, for COVID-related expenditures that were not otherwise authorized. And so this contract is actually to cover just the amount of expenditures that were made and distributed to eligible participants and employees who met criteria, submitted a form, and then did ultimately receive the cash grant. It does not have any administrative cost. because the program itself was available only to certain eligible employees who were covered under San Francisco SF City Option, and so the administrative fees were covered under the contract with the health plan for the that is normally for administering the San Francisco City Option program. And in the past, the SF health plan has had has met their requirements in the performance evaluations, both in terms of the program component, compliance, as well as customer satisfaction. I can answer any additional questions that you may have.
Let me ask one while you're talking, because now it's a clearer program. You're saying it's a one-time $500 grant under certain conditions, but then for nearly $15 million, that would mean about 30,000 people got it. Is it? Do we have 30,000 employees?
Yeah, so 29,807 employees did in fact meet the program eligibility criteria. Then they submitted a form where they validated their identity, and then they received the $500 grant. And so the $14 million is the direct cost of the benefits that were ultimately sent out. There were some folks who did not meet the criteria as well, but overall 29,000 did meet criteria and go through the process to apply for the program.
So how many city employees do we actually have in the entire county?
So we have over 400,000 employees who are a city option employee with different employers. And in fact, we have over 40,000 employees who are enrolled in one of our city option programs, the MRA program as well. So we have a large number of employees, some of whom have recurring contributions from their employers, and then we have also a large number of employees who may have received contributions in the past but are not currently receiving a lot active contributions currently.
Oh, okay. I see. The word employee is not really the city employee, but those who are actually part of the city option program, right? Which we're going to
Yes.
coming up.
Yes.
Okay, and then that was how many? What was the total number of those who were in that program? What did you say? 40,000 or 400,000, right? Or 100,000?
So we've had over 400,000 employees, just as being employees who are in the city option program and have received some contributions. Not all of them are actively participating in one of the benefits that we currently have. So within the 3 city option programs that are where an employee has taken that step to then enroll in a program and are using the benefits, we have around 42,000, the vast majority of which are receiving a MRA account. And so within that kind of universe, 29,000 actually were eligible for this grant and then applied and received the grant itself.
So of the 400,000, about 40,000 kind of meet the criteria, and about 29,000 actually did apply for it. Is that about right?
Yes.
Oh, okay. I'm just trying to get the numbers straight, because we have to try to report this succinctly and clearly to our commission if we're going to be approving this. Of course, it being retroactive, it would be very difficult not to approve it, I guess. But but the San Francisco Health Plan can probably afford it. But I don't think they would like that. What do you have a reason that it's retroactive?
So when this benefit was first launched, it was sort of, there was an impetus to get it out and get it so that participants or employees who can meet it could apply for the program and get the grant. And so I think we really try to move quickly to make the program available to the employees. And so that's and now that we're coming back to really try to figure out what's the best way to implement the contract.
Ms. Ruggles, could you give us a better explanation? Because this is prior to COVID, right? No, I guess it's not.
No, this is COVID. The mayor's the one that determined this, but when the mayor made this declaration to have this funding be made available, there was about 1,000 logistics to figure out in order to make the funding actually payable and accessible and reimbursable. So while the agreement was there, there was a lot to figure out before it could actually be written into a new contract.
No, I understand that. Now I understand this is probably, well, it is related to COVID, but the 14 million will be good for the 29,000 people, and that's what we're assuming is going to call for it, because this program goes on to 2021, the end of 2020.
Yes, so the 14 million is going to cover all of it in the sense that there was a time period in which those who were eligible were sent notifications, and they did have a time limit in which they could apply to receive the cash grant. And then this is the period in which they could, apply and cash their check was through the end of 2020. And so right now what we're doing is this is essentially everybody has gone through the process and everybody has claimed against the cash grant program. So there are no more expenditures outside of the $14.9 million.
Okay, I see. So even though we've extended the term, the program basically has achieved what it should have, and this is the final numbers. Okay.
Yes.
Commissioner Guillermo?
No, I think you've asked the questions that I had in my mind on this contract. I'm just anxious to hear about the actual proposal going forward that will hopefully simplify the medical
Okay.
program.
Right. Did we have public comment on this one yet, Mark?
No, we haven't. Person on the comment line, please let us know if you'd like to comment on item 6. No, I'm sorry, on item 5 by pressing *3. Again, item 5 comments, *3. No comment, Commissioner.
All right. So then we would be ready for a vote of recommendation to the Commission for acceptance of this contract.
I move recommendation to the full commission.
Okay, and I will second it and thank the staff for the clearer for the clear explanation. Thank you.
Thank you, everyone. Item 6 is the City Option Program Simplification.
So Mark, I am sharing my screen and I am going to put the presentation in full presentation mode. And is everyone able to see my screen?
Yes, Alice, it's clear, but there's a clicking, when you speak, there's a clicking sound. I'm not sure if you're able to control that at all, but it's a little distracting.
Oh, I'm not sure why that is. Should I try calling back in? Or?
No, it's fine. If you don't know what it is, let's just move forward. It's fine because it's possible to listen to you. I just want to make sure that if you could do something, you would do it. But thank you.
Okay.
Sorry to bother you.
All right, sorry. I'm sorry about that. Good afternoon, Commissioners. My name is Alice Craniati with the Office of Managed Care, and today we'd like to present a proposal to simplify the SF City Option Program. And I'll be going over some program background, how it works today, the goals and rationale and key components of the simplification we're proposing. And I'll also share a snapshot of before and after the simplification, a schedule of the implementation, and then end with other measures we're also planning to take concurrently to improve the overall utilization of the program. So in 2006, the Healthcare Security Ordinance was passed to support uninsured San Franciscans' access to insurance or healthcare. It had two main components: the Employer Spending Requirement, or ESR, which mandates that certain employers make healthcare contributions on behalf of their eligible employees, and Healthy San Francisco, HSF, a healthcare access program providing comprehensive healthcare to uninsured, regardless of their immigration status, employment, or any pre-existing conditions. At the time, DPH was tasked to administer the Healthy SF program and a second program called the San Francisco City Option Program. The SFCO program is one option that employers subjected to the ESR may choose to meet their ESR obligation through. Currently, if an employer chooses SFCO and deposits a contribution for their employees, the employee is notified that their employer has made a contribution, and then they are invited to enroll in one of the three benefits, either HSF with a discount, SFMRA, or SF covered MRA. Employees who receive HSF discount, they receive a 75% discount on their quarterly fees, which range between $0 and $450 depending on the individual's income. And employees who receive SFMRA receive a dollar-for-dollar medical reimbursement account, similar to many SSAs and HSAs that employees receive through their employers. And then employees who receive an SF-covered MRA receive a calculated subsidy to support their enrollment into Cover California insurance that's based on the individual's anticipated out-of-pocket costs for insurance after other federal and state subsidies have been taken into account. So of all employees who've enrolled into one of the three programs, 98% are enrolled in SFMRA, 2% are enrolled in HSF with a discount, and less than 0.5% are enrolled in SF-covered MRA. So while HSF with a discount and SFMRA were launched in 2008, SF-covered MRA was launched later in 2015. In 2015, DPH was tasked to create an affordability program to provide additional subsidies to those who continue to face cost barriers to enrolling in insurance. During the development of the program, there were two important program goals. One, to encourage enrollment into insurance and support the ACA, and two, to ensure that employees are enrolled in the right program, the right one of the three. As a result, DPH implemented the SFCO modernization, and through that, we launched the Covered MRA program in October 2015, so that employees could utilize their benefits in time for plan year 2016. We also implemented the SFMRA deactivation policy in July 2016, and we redesigned the City Option Program enrollment process so that it now included the new SF-covered MRA program, and it incorporated a way to screen employees for the right program, either HSF, SFMRA, or SF-covered MRA. Previously, the enrollment process required very little involvement from the employees. If an employer indicated that their employee had insurance and or was not living in San Francisco, they were automatically enrolled in SF-MRA. Otherwise, they were enrolled into HSF with a discount. So today, the enrollment process, which was really implemented to screen employees for the right SFCO program, and it's complicated and it's multi-steps and it can require in-person enrollment. So when an employer makes a contribution on behalf of their employee, the contribution is held in a pool until the employee takes action to enroll into one of the 3 programs. An employee receives notification that they have a contribution available and are encouraged to complete a program finder form. The program finder form is the first screening step to determine which of the 3 programs is the right program for the employee. If an employee is determined eligible for SFMRA, then they are enrolled and receive an MRA account that they then can use for a variety of expenditures. If they are determined eligible for covered MRA or an HSF with a discount, then in order to be fully enrolled into either program, they will need to complete an in-person enrollment process in order to receive their benefits. So this multi-step enrollment process is required to ensure that employees are truly eligible for HSF and to actually receive their calculated covered MRA benefits. While income verification is needed to verify a person's HSF eligibility and to determine the covered MRA subsidy amount, it's not necessary in order for an individual to receive an MRA, which 98% of the participants ultimately are determined eligible for. And at the same time, this multi-step enrollment process has become a major barrier to participation and utilization of the employer benefit in general. And so just to give a snapshot, as of March 2021, 41,000 were enrolled in SFMRA. 711 had HSF with a discount out of a total of more than 15,000 HSF participants, and a little over 100 were enrolled in covered MRA. So however, though, the 42,000 employees who are currently enrolled into one of the 3 programs really represent only around 20% of overall employees who received an employer contribution. And so in order to improve the employee experience with the program and to increase the overall participation and utilization of the benefits and the contributions employers have made, we're proposing to simplify the SFCO program. Originally, the projected enrollment for the covered MRA benefit was around 3,000. However, the actual enrollment has ranged between 117 and 489, with less than 1,000 individuals served cumulatively. At the same time, the program has heard consistent feedback from both employees and employers to make it easier to enroll and make it easier to use the benefit. So we think that with the simplification, we will be able to drive greater participation and utilization of the employer contribution. So our simplification proposal has 3 key components. Component number 1 is to transition from 3 benefits to 1 benefit, the SFMRA. Component number 2 is to provide a transition period for employees who are currently enrolled in the HSF discount and the SF covered benefits. And the third component is to relaunch an affordability program for plan year 2023. And the diagram shows the proposed new simplified program and new simplified enrollment process. So now when an employer makes a contribution for an employee, it will remain in the pool until an employee takes action to enroll. And when an employee then takes the action, they will now only complete a simplified program finder form. And the key difference here is that now the form's function is really merely to verify the employee's identity so that we can ensure that the contributions are deposited into the account of the employee and to prevent fraud and misconduct. Once the employee's identity is verified, they will be able to be enrolled in the SFMRA, receive an MRA account, and then be able to use it for the various expenditures that they have. If an employee so chooses, they can continue to enroll in HSF and use their MRA accounts to pay for any applicable fees. And once the new affordability program is relaunched, an employee can apply for that as well if that's the need. So the first key component is a transition from 3 benefits to 1 benefit, the SFMRA. This would allow us to provide a simplified and streamlined new enrollment process with no in-person actions required, and it would remove barriers to participation in the city option program in general. And in terms of impact, it would have no impact to 98% or about the 41,000 employees who are currently enrolled. They will not need to take any additional action on their part. Once the transition is implemented, all future employees will have a simpler process, and because all employees will go through the same enrollment process, namely to verify their identity, it will also be a simpler program to administer. The second key component is a transition period. For employees who are currently enrolled into HSF, transitioning to an MRA would allow the employees the access to their full employer contribution in lieu of a calculated discount, which then the participant can use to pay for an array of expenditure, including any of the applicable HSF fees. This would reduce the complexity and increase the flexibility and choice of the employee in how they wish to spend their contributions. For the 711 participants who currently receive HSF with the discount, they will be auto-enrolled into SFMRA and be provided with an MRA account, so they will not need to take any additional actions to enroll. And of the 711, 95% will receive a larger benefit from SFMRA, which is a one-to-one contribution from their employers, than what they're currently receiving through their HSF discount value, which is 75% of discount of their quarterly fees. And in addition, the 711 participants will continue to receive their current discount through the end of 2021 to help with the transition. And for employees who are currently enrolled in SF-covered MRA, the transition to SFMRA benefit would allow the employees to access their full employer contribution in lieu of their calculated benefits. And this provides the employee with greater flexibility in how they would like to use their contribution. Of the 117 participants currently enrolled in SF-covered MRA, all will be auto-enrolled into SFMRA, and there will be no action needed from the participants in order to enroll. 60% of the 117 will end up having more contribution as a result of the transition, meaning that 60% will receive more contribution through the one-to-one employer contribution benefit, the SFMRA, as opposed to their calculated covered MRA. And in addition, prior to the relaunch of the affordability program for 2023, to support these employees' transition, everyone will receive a subsidy in 2022 that is equivalent to their covered MRA 2021 benefit, and it will be directly deposited into their new SFMRA account. And anyone who needs additional support can apply for the new affordability program that is planned to relaunch in June of next year, with plenty of time in for plan year 2023. And so to provide for the 117 participants with subsidies for 2022, it will be covered by the excess unused covered MRA funds, and so it would not have any general fund impact. The third key component of SFCO simplification is to relaunch a health insurance affordability program. This would be to continue meeting the requirements of the HCSO for DPH to maintain an affordability program, and it will continue to support employees who still face cost barriers to enroll in health insurance. We're still working on the details of the program with stakeholders, but we want to simplify the program enrollment process, the program eligibility steps, and the program benefit rules. We anticipate that we'll come back to the Health Commission when the details are ready to be presented. And just a quick recap of the before and after of the SF City Option simplification. So currently we have 3 programs that require employees to complete multi-step in-person enrollment process. that requires for income verification and eligibility screening. After the simplification, SFCO will have one benefit, SFMRA, that is a dollar-to-dollar benefit of their employer's contribution, and the enrollment process will be a streamlined identity verification step and will not require any in-person enrollment. Employees will still be able to apply or enroll into HSF and the affordability program once launched separately. And with respect to timeline, we hope that with the Commission's support and approval, we would be able to start messaging and outreaching to stakeholders of the upcoming changes starting this month and next month. And then during the remainder of 2021, DPH would be implementing the program simplification and transitioning any employees who are currently enrolled with HSF with a discount and SF covered MRA, and then relaunching a streamlined new enrollment process. We want to make sure we're providing as much notification and outreach as possible ahead of open enrollment period for 2022. And then in mid-2022, we will relaunch an affordability program ahead of open enrollment for plan year 2023. And so while we believe that the SFCO simplification will reduce barriers to employees participating in the program and increase utilization of their employer contribution, we know that simplification alone is not enough. We're currently undertaking other actions as well, such as developing new dashboards to monitor our progress and gauge our effectiveness, and so we can make any adjustments if necessary. And these dashboards will also hopefully improve our data quality to support the decision-making and shorten any turnaround times to information requests from stakeholders. At the same time, we're continuing to improve our communication and outreach, including utilizing emailing and texting better, making info systems improvements, and really trying to improve the MRA reimbursement process, including utilizing debit cards. And so this is my the end of my presentation, and I'm happy to answer any questions that you may have.
Commissioners, just to note, Greg Wagner has joined us in case you have a question at his level during your discussion.
Oh, thank you, Mr. Wagner, for joining us. Is there any public comment?
Person on the line, please let us know if you'd like to make comment by pressing *3. *3. No hand, Commissioner.
All right, so I'll go on to Commissioner Guillermo.
Thank you. That was quite a lot to absorb. And so I actually had, I think my most basic question has to do with projected uptake based on what were apparently fairly low numbers of employees that have taken advantage of the programs to date. How are you projecting that there will be, or what the increase will be in terms of the numbers of employees that will now enroll in the modified program? Just as since we have a benchmark based on the old program.
So we don't have precise projections in terms of what we are anticipating that the uptake in the utilization will be. We obviously would hope to have a lot higher enrollment and participation, and we also know that there will still be a number of employees who do not end up participating, either because they're short-term employees that then have moved out of San Francisco, or we have not received good data from their employers to really make that first initial contact. But what we are anticipating is that we hope to gain good improvements through the simplification process itself, and to make further improvements in utilization through outreach methods, because even with the simplification, the amount, it still does require us to get good data from the employer so that we can contact the employees where they are, and that then we are able to successfully contact them in a method that they're receptive and responsive to.
I would suggest if it's possible that there are some numerical goals that we try to reach so that we can measure the effectiveness and the success of the outreach and to see whether there is any additional steps that can or should be taken to make sure that there's an opportunity to maximize the benefit that's available for employees throughout the city that otherwise would have compromised access to healthcare.
Commissioner, if I may, also, I think that's a great suggestion. We set some targets around enrollment, and I don't know if I apologize for being a little bit late. I don't know if Alice had previously or has at her fingertips, or maybe the health plan. For context, it's not the target itself, but the context on the number of individuals who have a contribution that currently sits in the pool and is not even making its way into the benefit program because of the barriers for enrollment. There are a lot of individuals and a lot of money that we can see that the employer has contributed and that is not making its way into a benefit for the individual, and that could be a some context for kind of what the order of magnitude of potential improvements is. So I don't have that in my fingertips, but I don't know if Alice or Cindy understood.
And
yes,
just on top of that, Alice, sorry, while you're answering, do we have any data on the languages, potentially the languages that are spoken by the employees that are eligible and or enrolled? Because just again, in terms of the outreach and the education that we would do either with the employers or directly with sort of the broad public, that I would imagine that we have a sizable population that it doesn't have English as their first language.
So we do have language data available, but a lot of our data are for employees that we are able to have had some initial contact with, where one of the issues that we do have, which is part of our communications outreach plan, and also just working with the employers, is to make sure we get good information from the employers so that we can make that initial contact with the employees. Once we have made a contact with the employees, we do tend to have a lot more information and can then provide the information in the language. And I wanted to just mention that we are currently working with the Controller's Office in terms of doing a project in which one of the goals is to identify some baseline metrics for our city option program and reporting that would then be helpful. So I think through that process, we would also be able to identify what are some good targets. And one of the important asks that we've asked is for the help is to look for other programs that are somewhat similar, right? Like an SSA and HSA. What are some comparable programs and what are some goals of enrollments, utilization that they may have, so that then would be informative of our own baseline targets. So I just wanted to mention that there are some projects that we are working with to look for targets for enrollments, for utilizations, for uptake, for communications as well. And so definitely it's a very important part of our overall program.
Thank you. And I actually am glad to see that this simplification program is proposed, and I'm really looking forward to seeing that the opportunities for those San Franciscans that have a difficulty in getting access to care because they can't afford it will really see the benefits of that are provided to them and enroll in a simpler way.
So thank you, Commissioner Guillermo, and I'm appreciative also of staff helping to clarify this very complicated scheme that we have for the HCSO, and also to understand better some of the financing. I think Mr. Wagner said, actually, this money is actually already here. And these are recipients of that benefit that aren't actually taking advantage of it, apparently, that is paying for this. So this is not more money out of the city, even as you're developing different benefits. So I understand that. I want to go back to just a completely nagging question in my mind. Where does this sit in the scheme? Is this the people who are not eligible for Healthy San Francisco, or is it the employers all have? Because I remember sometimes, the Magna will remember that San Franciscans are allowed to select Healthy San Francisco, and I could be wrong here, and those who didn't work or who didn't live in the county had an option to get a spending account. So are we talking about the spending accounts, or we're talking about the whole program?
We are talking about predominantly the individuals who are for the spending accounts. So as we mentioned, the Healthy San Francisco program is open to both employees who receive contributions through city option from their employers, as well as general SF residents who meet criteria. And so currently, over 15,000 participants and individuals are enrolled with Healthy San Francisco. And of those 15,000, 700 of them came in through the SF City Option Program. So meaning that their employer chose to meet their obligations under the spending requirements. And what they then did was the employee came in and then they got screened in that complicated process. And then out of the 3 programs, they were enrolled in Healthy San Francisco. And the benefit that they got was they got a 75% discount of their participant fees. There's a whole bunch of other people who are in the employee section that then were basically, after the screening process, were either given an MRA account or they were received a covered MRA program. So it's a bit of, it's really to simplify the employees who are receiving contributions from their employers through city option. But then amongst that, there is a small segment of about 700 people who the benefit that they're getting through their city option program is participating in HSF with a discount. Did that answer your question, Commissioner Chow, or did I make it more confusing?
Where was the separation between those who are San Franciscans and those who are not?
So under today, everybody who is an employee, they are first put into this pool. And then at that point, they are not enrolled into any of the 3 programs. And then they take an action to get screened for which of the 3. And when they are screened, one of the criteria is which program are you eligible for? And if you are not living in San Francisco, then you're not eligible for Healthy San Francisco. And so you would have gotten an MRA. And so that's the sort of determination. But if you were an employee who was in the pool, then you took an action to get enrolled into one of the 3, and you were screened and you had all of the eligibility criteria for the Healthy SF program, then you could enroll in Healthy SF. And then as a benefit, you would get it at a discount.
So the proposal is that, as I didn't understand, everyone who gets a contribution would then actually be eligible to enroll in the SFMRA.
Correct.
And
And then if,
yeah, go ahead.
oh, sorry. So the proposal is, instead of trying to screen everybody for all 3 programs, what we would do is just once they are able to verify their identities, they would get an SFMRA and they would get an MRA account. And if at that point they are also interested in enrolling in HSF, because that's the option that they would like to access healthcare through, they can continue to enroll in HSF. And then what they could then do is they could then use the contributions that are now deposited into their MRA account to pay for any fees that they have, or they may choose not to use that. They could choose to do, you know, they can use it for pharmacy or, you know, save it up, or however they would like to do it. And so the idea is that it would be much simpler because everyone would get the same program, but they would still be able to access all of the other 2 programs, and then they can just choose to use their MRA in a more flexible way and how they would like to use it.
Okay, now that sounds very simple. Okay, and that clarifies it. It's somewhat so. So rather than going through an enrollment interview process that might say you could go to Healthy San Francisco with discount, or that you go directly to Healthy San Francisco, everybody will go through the MRA and then make their decision.
Correct. And so we hope that that is, because of that simplification, that will make it so that more people would be willing to take that step to then enroll and use their benefits.
And these would include employees who were both in San Francisco and outside of San Francisco.
Correct.
Although the eligibility for Healthy San Francisco would not be changed. So if you don't live in the city, you still wouldn't be eligible. What this really does is it just, you know, instead of us setting up 3 separate programs and running 3 separate programs, we're just giving everybody an MRA, and then they can use that money in the MRA to access those programs. So we don't have to, but it won't actually change the criteria for Healthy San Francisco. So you'd still have to meet the residency and the income requirements for Healthy San Francisco. It would just simplify how the money flows and what the experience is for the individual in accessing the program. So
it sounds like from what this is, looking at where we are now standing, that almost everybody actually has an MRA account, and a few actually come to Healthy San Francisco by way of this process from the employee side.
Correct. And for those few who under the current system, those few who do access Healthy San Francisco, those 700, and for the small group that uses the current covered MRA, it's the administrative effort and expense is very disproportionately high to administer those programs, and it's complicated. So under the new scheme, it would be simpler to administer. You'd still end up at the program that you want to end up at, but we'll be much more efficient in the process, and it'll feel better to the individual.
And if I may, this is where the question I had about enrollment goals, numeric enrollment goals were projected because of the 711 out of, I can't remember how many that are eligible for the city option. If they are San Francisco residents, I would imagine that if this simplification works as proposed, that we would get a higher enrollment in Healthy San Francisco for those who are eligible. Is that correct?
That's possible. I think we'd have to talk about this internally. I think that probably the metric that I would think about is, each individual is gonna, based on eligibility and their choice, they're gonna decide which program works best for them. So some that might be Healthy San Francisco, some it might be having an MRA and using it to pay for their uncovered medical expenses that they're incurring in other ways. I think that the metric that I would look toward is the money that's getting contributed into the program from employers. What proportion of that money is actually ending up benefiting the individual and how quickly? And so that could be a combination of how many get enrolled in, how many use their MRA to pay for Healthy San Francisco, how many use their MRA to pay for Covered California, how many use it for other expenses. And I do think it makes sense to set those targets, and we probably will have increased enrollment because the more people who have an MRA are going to look for a way to spend it. But I think we would want to target both Healthy San Francisco plus the other uses of the MRAs. And we do have, through the health plan, they've done research on what some benchmarks are for a good utilization of those reimbursement accounts are. And we can use that, I think, as a foundation to look at our progress for how much of that money is getting into the accounts for the individuals, and how much of it are they using for their benefits. So that would be Healthy San Francisco plus other medical benefits in the other categories of the program.
So I'm thinking that as we're presenting this in several weeks to the commission, it might be good to try to clarify what Healthy San Francisco really is also, because I think that some of us kind of look at it as one big umbrella program, and clearly this is that segment which is really the employer contribution for the employees working in San Francisco firms, right? Many of whom aren't in the city, and therefore we put aside where Healthy San Francisco is and how many people they are, and that this is the group that we're talking about. And that helps clarify some of us then who, kind of live through this whole thing and have just kind of hodgepodge of where we are. Not knowing that this is a great plan, but then all of a sudden you're trying to figure out, is this the one? To me, this is the one then in my mind that says, okay, you're not eligible for Healthy San Francisco. Employers have to pay. They might be like part-time workers, right? Rather than putting them onto their own health plans, they're paying into this. And these employees really need to take advantage of the dollars put for them. So I think that would put in context what we are talking about. And then now we know the focus group that we're really trying to get to. And then if you can have some metrics or ideas of what the metrics might be, I think that could be helpful at the presentation. Commissioner Fuyama, any other things that you might want to see clarified? Also, just trying to see how this can be clearer, because certainly the goal is laudable, and the idea that staff has thought up how to simplify this and really make it more effective is, I think, to be thanked very much, and we will look forward to that presentation.
No further questions. Thank you, and appreciation to the team there for the work that was put into the simplification program, and looking forward to the outreach efforts that'll result eventually.
Thank you for your questions and feedback, because it's helpful for us to, there is so much going on in this territory to help us to figure out how to present it in a way that's clear and digestible. It's
no, thank you. It's very complicated, but I'm glad someone thought of simplification. We don't often see that, do we? Okay, Mark, where are we on the agenda?
We're now, thank you everyone, by the way, again, item 8 is emerging issues.
Well, Commissioner Guillermo is the emerging issue. I guess, how best can we bring her up to date on, you had a good introduction here because we had small numbers of items under each of the categories.
Yeah, it was a good overview. And I did get an orientation from Secretary Morwitz, which was very, very helpful. And for me, I'm just trying to connect the dots between what happens in this committee and the full commission. And so that'll take me a little while, but very, very helpful to have had the opportunity to participate in this particular agenda. Yeah.
Okay, well, thank you very much, and we'll look forward. All of us will look forward. I'm sure I speak of with the approval of the chair that we all look forward to your participation. So, I think we're at public comment, right?
Yes, sir. Item 9 is public comment, and person on the line, if you'd like to make general public comment, which means commenting on something not on this agenda, you're able to do so by pressing *3. *3. No hand, which means, commissioners, you are out of consideration for adjournment.
So consideration for adjournment,
Move to adjourn.
and I would second that.
All right. Thank you, everyone.
Or adjourn. Thank you.